Hi, I'm Sheila Martins, President-elect of World Stroke Organization. It's a pleasure to be here today to talk about the World Stroke Organization Action Plan. Here are my disclosures. So, the World Stroke Organization is recognized as the lead global organization for stroke by the World Health Organization. It was established in October 2006 through the merger of the International Stroke Society and the World Stroke Federation, with the purpose of coordinating efforts and constituting one world voice for stroke. Today, the World Stroke Organization has more than 13,000 individual members. Membership spans 100 countries, over 90 society members, 9 global congress, over 20,000 visitors, 70 stroke support organization members for 46 countries, 90 society members representing 55,000 stroke professionals. Early campaign reached around 7 million this year. More than ever before, World Stroke Organization has become the global voice of stroke and has extended actions and campaigns worldwide. The board and the committees have a global composition and represent all geographic regions as the only worldwide organization. I'm the president-elect from Brazil. I will start the presidency in 2022. The president now is Mark Fisher from US, the past president Michael Branning from Austria, previously Werner Hack from Germany, Stephen Davis from Australia, Bon Novrin from Sweden, and Geoffrey Dunham from Australia was our first president. And our vision is a life free of stroke. Our mission is to reduce the global burden of stroke through prevention, treatment, and long-term care. How? So first, we want to increase stroke awareness among populations and health professionals. So education is a very important part of World Stroke Organization. Influence policies for stroke prevention and improve the health services for acute care and early rehabilitation. Facilitate advocacy for better care and research relevant to people with stroke. We have several different committees to achieve our goals. Well, about the partnership, to develop a stronger voice and engagement with World Health Organization and United Nations to ensure that stroke has a place in the World Health Agenda. We participate in the creation of International Classification of a Disease 11. We include the TPA as essential medicine for World Health Organization and stroke units as a priority. In 2021, we include mechanical thrombectomy devices in the list of priority medical devices. So this is our whole, and you can see here, World Stroke Organization participating in the World Health Assembly. We participate in the technical package of hearts from World Health Organization for primary prevention to reorganize the cardiovascular care in primary health care. We are participating in Non-Communicable Disease Alliance agenda. Bon Novrin was elected to the board of directors this year. It's a proud for us. And we want to strengthen the voice of stroke support organizations. So World Stroke Organization support them for this in 2020. Saw the completion of our first ever global mapping report, which includes data on profile and activities of 92 organizations in 58 countries. So it's a very interesting and important tool to evaluate the situation of SSOs across the globe. So here, several different stroke support organizations and the distribution across the globe is a proud for us, a wonderful job of Sarah Belson. World Stroke Organization participate in the creation of Circulatory Health Alliance together with Heart Federation and other organizations. And here is the launch of a white paper for circulatory health. You can see here the meeting this year about the preventing the next pandemic, the case for investing in circulatory health. Now we have a partnership with American Heart, American Stroke Association to build a global quality campaign to develop standards of quality in low-income countries to help them to develop new stroke centers to monitor the data. So it's a very new program together with American Heart. Well, we have a very strong educational part committed to providing members with access to educational material and resource aimed at improving stroke care and reducing the global burden of stroke. These materials are available in various forms, including webinars and other online resources as well, teaching courses. So we have the International Journal of Stroke, we have the World Stroke Academy, we have an important educational part with a Future Stroke Leaders program, and we launched the roadmap for stroke care delivery in 2014. The World Stroke Academy team is multicultural from different countries. They are a great team that prepare teaching course, webinars, and education through Twitter that is very interesting and followed for more than 5,000 people today. The paper of the month is a very interesting and new part of World Stroke Academy. The paper is chosen by Gustavo Saposnik, that is the editor-in-chief of World Stroke Academy, and discussed it through webinars and Twitter and in the website of World Stroke Academy. So it's a very important tool for education from World Stroke Organization. We have several educational courses in different parts of the world. You can see here Bolivia, China, Philippines, India, and Sub-Saharan Africa. We have a World Stroke Congress uniting the stroke community in different parts of the world. The Congress are very important. It's a unique meeting because it's not only a scientific meeting, but includes a lot of implementation. So experts in implementation discussing how to do it, showing different examples of implementation of stroke care in different parts of the world, including prevention, acute stroke care, and rehabilitation. And also the World Stroke Congress and regional meetings have work a lot with the governments. Here in Brazil, it was very important. Here you can see the Minister of Health of Brazil. And since then, improve a lot the stroke care in the country. And here the same in India, that improve a lot the stroke care in India after Stroke Congress. We did the same in several different parts of the world with scientific meetings, but also political meetings. You can see here the Minister of Health of Romania. And here we have the Latin American Stroke Ministerial Meeting with several representatives of Ministry of Health of 13 countries discussing with World Stroke Organization how to improve stroke care in the region. So we have this role in the world to discuss with health managers how to improve the stroke care in different regions, tailoring the program to each region. World Stroke Campaign is a very important part of World Stroke Organization to educate the population about stroke with several initiatives in different parts of the world, including teaching children about stroke. We have published several important papers. Two important papers were the papers about the Cut Stroke in Half program, led by Michael Braining and Valerie Fagin, with the idea to use multi-level community interventions, primary stroke prevention, a conceptual approach by the World Stroke Organization. We launched a global prevention of stroke and dementia World Stroke Organization declaration talking about to prevent stroke. How could we implement all these strategies suggested by World Stroke Organization? You will see here the example of Brazil in this BBC and World Stroke Organization production.
For 20 years, stroke was the first cause of death in Brazil. We didn't have anything to treat stroke patients, so we started in the last 10, 15 years with the stroke neurologists and now other health professionals to implement acute stroke treatments, stroke units, and to create a national stroke program. We have a lot of success, but we have several challenges. One of them is really we have overcrowded emergency rooms, and we didn't have doctors trained to assist these patients, and now we have. SAMU is our pre-hospital. Since 2008, SAMU is integrated in the National Stroke Network, so they are very well trained to assist stroke patients and assist fast and take the patient to the right hospital.
Então, essas intervenções de conseguir colocar o paciente certo, no lugar certo, no tempo certo, principalmente ligado ao AVC, ao stroke, ao infarto e essas condições agudas que determinam vida ou morte, ou sequelas graves, ou quase ausência de sequelas, se bem manejadas, elas são muito importantes para integrar no sistema de saúde.
We have areas without neurologists, and we launch a new program. We are using an app, so the specialists can discuss the case, and the other residents can give opinion, and you can see the results, and you can integrate the whole team.
Em grande parte das grandes cidades brasileiras, uma rede de cuidado agudo do AVC, que é exemplo para qualquer lugar do planeta.
We increase 3 times the chance of patient be normal. We increase 2 times the chance to be independent for the daily activities. And we decrease the mortality and severe disability. And now we have the first developing country that proved that treatment of stroke can be done and is cost effective in public hospitals. It's improving a lot the stroke care in Brazil, but still we have 400,000 strokes and more than 100,000 deaths. We are much better than before, but it's not enough. We have several campaigns for the World Stroke Day and World Stroke Campaign. A few years ago, we launched Running Against Stroke because the exercise can decrease the risk of stroke. We have campaigns inside the stadiums with football players. We can reach in one game 4,000 people. We have 10 main risk factors. These 10 factors can represent 90% of cause of strokes. In order to reduce the risk, we will use Stroke Riskometer app, polypill, and health community workers. Riskometer is an app created in New Zealand with an evidence-based score to evaluate the risk of stroke. You can see how to modify your risk, increasing exercise, decreasing weight, improving diet. We really believe that we can cut stroke in half with this program.
Se caso o papai ele tiver com a boca torta, com o braço sem força, não conseguindo falar, o que tu tem que fazer se tu estiver por perto?
Colocar na cama e chamar o SAMU.
Now we have a new campaign. This is an international campaign for children from 4 to 8 years old, teaching about the risk of stroke and with games, how to know the stroke signs and how to call the 192, that is our national ambulance. The name is FAST because we have to arrive very fast in the hospital to decrease the risk, so the children now can be hero and safe for the grandparents. We can really change the system, the whole stroke system of care, working together with doctors, nurses, and students and residents. And I can see that you can change people's lives with this work.
So what we are doing now and what is the future? We have now, since 2020, the Future Leaders Program, developing the next generation of global stroke leaders to drive transformation of stroke prevention, treatment, and support in years to come. We have now 32 participants from different parts of the world. We have a program for early career stroke practitioners, you can see here, young neurologists traveling to different parts of the world to learn different perspectives of stroke care. This was a very important paper because show us where we are. World Stroke Organization launched the Roadmap for Stroke Services, a very important tool published in 2014. And this now is online. We launched 2 months ago to help the hospitals to evaluate the situation of their own hospital, classifying minimal stroke services, including areas without doctors, essential stroke centers with thrombolysis, and advanced stroke centers with thrombectomy, so this center can see the situation and what they need to improve in the same category and what they need to upgrade to a higher category. And also this can help to identify hospitals that are minimal without reperfusion therapy, but has a potential to be an essential center with thrombolysis. We launched a certification program, World Stroke Organization, together with Ibero-American Stroke Society. We have 11 countries participating together with stroke societies, neurology societies, and Ministry of Health to develop a quality program to certificate the hospital to ensure the implementation of all high priority strategies that change the natural history of stroke. And we have first an online part, and they need to show at least 4 months of quality indicators registry. And after we have an on-site visit, we start in March 2021. We already certify 4 hospitals, and we have 28 hospitals waiting for on-site visit for certification. The certification has no cost, and for this we have several partners here. So to finish, I will show you the World Stroke Organization recommendations to implement stroke services in low and middle income countries, and an example then how to implement, including the evaluation of cost and cost effectiveness of the implementation.
Build your team with people with the same ideology. Organize your hospital, pre-hospital, and local network. Evaluate the country situation. You can use the online roadmap for this. Organize stroke centers with stroke units. Implement IV thrombolysis. Establish teaching course. Organize awareness campaigns. Implement telemedicine for areas without trained doctors. Implement thrombectomy, 1 center to each 1.5 million inhabitants. Implement data quality monitoring, this is fundamental. Implement research in stroke that can help you to implement new strategies, and organize collaboration with regional countries. And how to translate this to another areas? I will show you the African Task Force, a pilot program in 5 hospitals in Africa, 3 in Ethiopia and 2 in South Africa. Ethiopia don't have TPA in the country, and South Africa has several stroke centers, but we will implement in rural hospitals without CT scan to evaluate the concept of create a stroke unit, the basic protocols of a stroke unit. What you did, we evaluate the hospital's structure with online roadmap. We performed virtual visit to evaluate the structure of the hospital and to meet the directors of hospitals. We implement TPA in Ethiopia. We start a telemedicine program in the 5 hospitals with a joint app donated by our company, with telemedicine without borders, with specialists from different parts of the world giving advice in real time for treatment in the project. We implement simple stroke units in 5 hospitals for a safe place to treat these patients and start early rehabilitation. We implement an educational program, first in English and now will be translated to local language to train the whole team. We start data collection to evaluate the baseline, including the cost of stroke, and to evaluate after 6 months after implementation of the program. After the initial organization, we started training for pre-hospital and campaigns to educate the population. And we hope in 1 year we can show the results to the government to stimulate a national plan. The stroke centers will be opened in October 29, the World Stroke Day this year. This wonderful team is working in this project with the 3 stars, Stacy, Mero, and Sable, the local implementers of the program. And the final message, it's possible to organize acute stroke care in low resource settings. We just need to discover in each country how to make it possible. We have the evidence on our side. If you don't have the evidence, we design and implement a clinical trial. Ask for an audience with your national health authorities. Don't ask for money for the project. Ask for an opportunity to be heard. Probably you know what you need to do, but international experts can help a lot to support your ideas. WSO can help you and endorse your plans. We are here for you to help you. So join us and help us to make the difference in the world.
Thank you.